Hello guys, welcome back to my channel. If you are new here, thank you for watching. I would want you to like, subscribe to my channel, and let's make this interactive. I know this video is coming late because October is ending and October is Pink Month for breast cancer awareness creation, and I would still want to do this video and create awareness. All the time you have to be aware of what is going on in your body as a woman. So I want to throw more light, or a little light, on breast cancer on my channel. So what is breast cancer? Breast cancer is any form of cancer that affects the breast, and it usually affects females because females have breasts. Yes, males do, but males don't really have breast, but females do. So when a cancer affects your breast, it is termed as breast cancer. What causes breast cancer? We don't really have a particular cause of breast cancer. All we have is predisposing factors, or things that put you at risk for developing breast cancer. And what are some of these things? The very first one I would say is that breast cancer tends to run in families. If any family person or a great aunt and great grandparent of yours has had breast cancer before, then you are predisposed to getting breast cancer. Also, if you are obese, if you are overweight, obese, you are predisposed or likely to have breast cancer. If you are wearing too tight braziers, the females, if you are wearing too tight braziers, you are putting yourself at risk. And if you are not eating well, you are putting yourself at risk. Also, if you are taking in alcohol and smoking, you are putting yourself at risk for getting breast cancer. And if you wear brazier for a long period of time, some of us do wear braziers and then sleep without braziers, it puts you at risk for getting breast cancer. What are some of the signs of breast cancer, or things that you see on your breast that you know that it is a sign of breast cancer? The very first one I would say is a lump in your breast. As females, we have to know ourselves, and if you realize any change, that there is any lump in your breast, usually going to your armpits when you are examining yourself and you feel a lump in your breast that is very unusual from the normal lump in your breast, then you have to quickly see a doctor. If you see there is a formation of dimple on your breast, it can be one or two or of your breast, you have to see a doctor. If you see that the skin around your breast is changing, please see a doctor. And also, if one breast is becoming larger, obviously larger than the other breast, please be able to see a doctor. Most of us have one breast slightly bigger than the other. That is normal. But if you see that there is any unusual change in shape or size of your breast, quickly see a doctor. And then finally, if you are not breastfeeding and then you realize that there is any discharge coming out of your breast, please do well to see a doctor. How then do we prevent breast cancer? As I said earlier, in the predisposing factors or the risk factors, if you actually do the right things, you are going to minimize the probability that you have breast cancer. And so I'll list some of these things. You have to exercise. If you are obese, you have to cut down your weight. And also, you have to make sure that you are eating well, a lot of vegetables, a lot of fruit. You don't eat junk. You have to avoid wearing brazier for a long period of time. Don't sleep with your bra. Just free your breast at night. Don't sleep with your bra. Don't wear too fitting or too tight braziers. It doesn't go a long way to help us. Okay, so what should we do? As a lady, you are to have self-breast examination at the end of your cycle every month, so that you get to know your breast well, you get to know yourself well, so that in case you are seeing any changes, you can quickly run to a medical professional for help. And also, once a year, if you're above the age, I would say 25, you should have breast mammogram done for you. You can walk into the hospital and then tell the doctor you want to have your breast checked for any lump. It will go a long way to help us. Cancer is not really curable. Yes, we don't cure cancer. You can prevent it, or you can minimize the probability of getting cancer. But once the cancer happens, you can't cure it. You will only be given therapy, put on medications for the rest of your life, And if you don't detect it early, you might end up losing your life, which I don't want to talk about today. So please, I hope you like this video, share with your friends, let's create awareness. Tell your mom, tell your aunts, tell everyone around you, every female around you who needs to see this video, and give it out to them. Thank you so much. Do well to subscribe, like my channel. Thank you all. I love you.